Module 5.3 Pet Care Training for Bello Project Volunteers. Care Concepts for Working with Clients' Rabbits. The concepts in these modules were developed by members of the Home Hospice Association. Learning Objectives. We aim to give our volunteers a common understanding of concepts necessary to provide high-quality care to our clients' rabbits. We want to empower our volunteers to know how to relieve the client of the physical work of pet care. We hope to provide our clients with the peace of mind that they can stay with their pets until their life journey is complete. General points when taking care of clients' rabbits. Our clients have known their pets for much longer in most cases than we have. They are entrusting us with the care of their animal friend and family members. The clients should be encouraged to maintain authority and decision-making regarding the daily care of their pets for as long as they are able to. It is not our job to change things. Rather, we should ensure the wellness of the pet while providing peace of mind for the owner, except in some cases when the owner and family members are absent, in which case we may become the primary caretakers for the animal. Every animal we will be working with will have a unique temperament. Understand that these animals will be undergoing life changes as well, and may experience fear and anxiety due to changes in their home and safe space, thus changing their temperament at times. General breed information. Large and giant breeds are more laid back and less excitable than small and miniature rabbits. Rabbits are unable to vomit, therefore making something such as a hairball a major concern. Long-haired rabbits especially require more maintenance, often hours of grooming to prevent this. You can be prepared to handle most rabbits by becoming familiar with reading their body language. Despite being the third most popular pet following cats and dogs, many owners do not realize their relationships with their pets are somewhat one-sided, as they don't fully understand their pet rabbit's behavior. The following information will help you to identify common rabbit behavior and understand their meaning. Rabbits can play. They love to push or toss objects around. If there are no toys available, they will even use bowls or litter boxes. It is important to observe the rabbit's enclosure, especially if there have been environmental changes. Ensure that the rabbit is not able to pull anything inappropriate into the enclosure, such as wires, plastic bags, blankets, or medical equipment. It is important for rabbits to chew all day. Whether they are chewing on an appropriate toy or munching away on hay, it's vital for not only their oral health, because rabbits' teeth grow continuously, but also for their digestive health. Relaxed rabbits will suddenly fall or flip over onto their side, exposing their belly. This is a sign of a totally relaxed and comfortable rabbit, and is a good indicator of a comfortable environment. Rabbits can also emit a low tooth clicking noise, often described like a cat's purring, as a sign of pleasure and contentment. This usually occurs while a rabbit is being petted or stroked, and is another indicator of a completely relaxed rabbit and comfortable environment. Happy rabbits will also dance, or binky. This can be described as a frolicking series of sideways kicks and mid-air leaps accompanied by a few head shakes and body gyrations. Rabbits can show aggression when afraid, in pain, or possessive with their toys or habitat. They may lunge or appear tense with an upright tail and laid-back ears. Some rabbits are vocal and will make grunting noises when they feel threatened or to show their disapproval if they do not want to be handled. This can also be displayed through tail wagging and thumping. This behavior can sometimes be followed by scratching or biting if they continue to feel threatened. Most will also rebel when you rearrange or move items in their cage, so try not to change their habitat to keep them happy. Remember that animals care more about your body language than the words you speak. Focus on the message your body is giving to the rabbit and pay attention to the rabbit's response. Remember that animals exhibit reinforced behaviors. Reinforce good behaviors and remove reinforcement for unwanted behaviors. What is positive reinforcement? Positive reinforcement is not just about giving treats for good behavior. It is about moving and performing the exercises or wanted behaviors in a way that makes it fun for the rabbit. You can use anything that the rabbit likes as a positive reinforcement, such as toys, petting, attention, access to the outside or a play area, or treats. How to greet a rabbit. Rabbits have a small blind spot in front of their nose, so when approaching to pet a rabbit, it is advisable to extend a hand at an angle. Rabbits generally do not like to be picked up or held. However, allowing them to approach first, investigate, and explore you on their level is a good introduction. Approach the rabbit's enclosure. Enter the rabbit's enclosure slowly if it's in a room or a pet pen. Get on the floor at the rabbit's level. Let the rabbit come to you to investigate. If the rabbit does not approach, you can offer a treat. If the rabbit does approach, slowly reach a hand toward the rabbit and allow the rabbit to decide if they would like contact. If they advance, slowly pet the rabbit. If in a cage, get at the rabbit's level and open the cage door slowly. Let the rabbit approach. Slowly reach your hand toward the rabbit. If the rabbit does not approach, you can offer a treat. If the rabbit does approach, slowly reach your hand toward the rabbit and allow the rabbit to decide if they would like contact. If they advance, slowly pet the rabbit. We will be responsible for safety. Please ensure that proper enclosures or pens are used if allowing the rabbit out for some playtime. There is nothing more scary than having a rabbit go running loose in busy traffic or risk exposure to an unknown pet or circumstance. If you are ever in a situation where you feel uncomfortable or a rabbit is too challenging for your comfort, please inform your care coordinator who will address the situation. This does not make you unqualified to handle rabbits. Some rabbits are better with different people. All that really matters is that you are able to relieve the client's workload, look after the well-being of the pet, keep everyone safe, and have fun while volunteering. Remember that the rabbits you will be working with are going through life changes too. Some of these changes may include changes to routine with times of feeding, sleeping, or exercise, an increase in the number of visitors or strangers to the house, such as medical staff, family and friends, support staff, and you. Environmental adjustments to the home, like furniture moved, a bedroom changed, or even a household move or temporary alteration. The addition of medical equipment, like hospital beds, oxygen or respirators, and medical supplies such as IV poles, bandages, and various pill bottles of medication. Because the pet owner you are working with may be preoccupied with their illness, medical appointments, visitors, etc., you can watch for safety issues in the home which may affect the pet. Depending on the stage of the illness and many other factors, the pet owners simply may not be able to keep up with everything in their environment, or may even be bedbound. This is precisely why you are there. So, how can you help? Be aware of household dangers. Are medications and health supplies kept out of reach of the pet? Is the garbage secured away from inquisitive pet noses? Did the owner receive plants or chocolate or other food gifts that have been placed where a pet can reach them? Some plants and foods are toxic to pets when ingested, and this must be addressed immediately. Some pets will eat just about anything, even non-food items, which may cause serious or even life-threatening health risks. Bring up any concerns with your care coordinator so a conversation can occur about a new location for these hazards. New locations for items of concern should be agreed upon by the pet owner and/or family in the house. Since you may be the primary caregiver to the pet at some point, you will have to be able to recognize health concerns in the animal. The best way to do this is to get an understanding of what is normal so that you can start to pick up the abnormal. The care coordinator will have an initial conversation with the pet owner or person responsible to discuss any existing concerns, pending concerns, vet history, grooming issues, food sensitivities, and behavior patterns to help us identify changes that may occur under our watch. It will be your job to ensure any changes in health, diet, or behavior are brought to the attention of your care coordinator. What should you look for? Questions you should ask yourself every time you visit the animal are: 1. Is the rabbit eating and drinking well? 2. Is the rabbit digesting properly, having regular bowel movements? Report any diarrhea or changes in stool consistency. 3. Is the animal behaving normally? Does it seem upset? 4. What changes are happening in the house that may be potential for fear or anxiety of the animal? 5. Can you preemptively create a solution when you foresee changes that may cause fear or anxiety of the animal? Here's an example of a preemptive solution to a foreseeable source of anxiety that may occur when caregivers and family have left the house and the owner is too weak to deal with the situation. In this scenario, the client has had to move some of their furniture to make room for additional medical equipment. The family came earlier in the day and moved the furniture. The rabbit's enclosure was also moved to a different area. Usually, the rabbit's enclosure is against a wall with no power outlets or cords. The new area has the rabbit enclosure in a room against a wall with cords and a power outlet. Everyone has left. The avoidable problem here is that the rabbit became agitated with the change in their environment and started to chew at the exposed wires. The owner was unable to access the area, leaving the rabbit at risk for electrical shock and damage to the electrical equipment. If you were able to foresee this issue when you came to care for the rabbit, you could have asked the client if they wanted the rabbit's enclosure moved away from the power source to ensure that the pet's needs were met in a safe environment. Other things you may have to watch the pet for include depression, irritability, and mischievousness due to boredom. All of these may indicate that the pet may require more visits to ensure its well-being and also get rid of some energy or frustration that are causing anxiousness, restlessness, and mischievous behaviors. A logbook will be placed in each home for the volunteers to keep track of behavior, food and water intake, as well as feces passed and urine output. It will be very important to keep up with this log every time the rabbit is visited. You are the eyes, ears, and voice of the animal in your care. You are the peace of mind for the owner with terminal illness and their family. Congratulations on completing this module and playing a very important part of the rabbit's well-being.